You're listening to the Public Health Epidemiology Careers Podcast, Episode 68.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me on this episode. In this episode, we're going to share with you the key takeaways from the 2018 American Public Health Association's conference in San Diego. I had originally planned to just share my thoughts, but decided to reach out to others in the community, others who had attended the conference, and gather feedback from members of our community as well. So first, I'll go through the collective feedback, and then I'll share with you 5 of my personal takeaways from the conference. So I asked the same question to several different people. They had basically a link to a SurveyMonkey that I put together, and I collected those responses. So the first question I asked was, what did you like most about the conference? And really, hands down, the emerging theme, the common theme among all the responses was networking. So the thing that everyone liked the most about the conference was networking. So just specifically, some of the responses said networking as far as the classes on chronic diseases, meeting other MPH students who are interested in similar research and attending roundtable discussions and having the opportunity to speak directly with researchers and programmers, meeting professionals in the field. Another set of responses was they like the speedy networking events. And then some of the responses just simply said the networking. So the common theme for what people like most about the conference was networking. And I tend to agree. That's one of the things I like the most. But I also really like the research. I really enjoy staying up to date on the latest research in public health, whether it's a poster presentation or it's an oral presentation. I just really like being up to date on the research and looking at what people are doing and the methodology and the findings. It's really exciting to me. It's one of my favorite parts. So the next question I asked was, what did you like least about the conference? Again, these are just open-ended questions, but the emergent theme here was that people did not like that there were so many overlapping presentations, like really good presentations, and there were so many that overlapped. So specifically, too many good and interesting presentations overlapped, couldn't see them all. Let's see, another one says overlapping presentations in committees. More just kept saying really interesting events were taking place at the same time. Too many interesting events taking place at the same time. So the common theme there is overlapping presentations. Now, there were some other other responses that did not exactly fit that category, or there's a little, if we were talking statistically, we talk about those outliers. But I don't have their permission to mention names, so I won't go into any further. And since they were just kind of one-off, I just kind of sticking to the common themes as I discuss it here with you guys. But I did have one that was a bit of an outlier, but I'm going to mention it because I can resonate with this one to some degree. And the response just simply said the redundant conversation and presentations about 25-year-old health problems. And I can understand where that's coming from. We are really having conversations about problems that are very old problems, and they are redundant because we have not figured out the solutions. And one of the things that I remember hearing several speakers mention, and that included our Surgeon General and our Executive Director, Dr. Benjamin. One of the things they said, and there were others that said this as well, but some of the actions that we need to take now in terms of policy and advocacy and really taking action over these next few years are really important so that we don't have this repeated conversation in another 5 years or 10 years down the road. So I guess to maybe break this cycle, there are definitely some more dramatic actions that need to be taking place. And there was a lot of conversation about policies that need to change, and we need to advocate for policies that align with, our mission and our vision for public health. Now, that's Dr. Huntley's interpretation of these things, and my response to that comment. I don't know if it's as simple as that, but that's just my takeaway, adding to what this respondent had typed in there as well. Now, another question that I asked was, what were your top 1 or 2 key takeaway messages from the conference? And I am just going to read a couple of these that I've just selected as some of my favorites among the responses that I received. So again, the question is, what are your 1 or 2 top takeaway messages from the conference? So one respondent said, public health covers a lot of topics I don't get to see every day. And a lot of researchers and students are doing amazing work. And this person gave me her permission to give her name. So Barbara, thank you for that response. I really think that that's part of why I like the research so much, is because I do get to see something outside of what I normally work in and what I'm normally involved in every day. And it's really exciting to see what people are doing. So I agree with you on that comment, Barbara. Another response was, health inequality still exists, and it's up to each public health official to make a difference in their own way. And I agree with that one. That's very strong. And this is sort of aligning with, I guess, the response and the comment about the redundant conversations and presentations. I mean, that's really what we're going to have to take some dramatic actions in order to not have these repeated conversations another 5 years or 10 years from now. Another response in terms of a key takeaway was, stay hopeful and persevere. That was a key takeaway for another respondent. The health issues and topics that I'm interested in won't conclude in the next 2 to 5 years. The field of public health aims to create long-term change, and the fruits of our work may not be realized for some time. And that's an important point, because, almost the idea of the seeds that we plant today may not harvest for years to come. But we do have to continue to do the work. So sometimes we will see we'll reap those benefits and we'll see those changes really quickly. And some of those will take time. So I do agree with that as well. And let's see. Another response here is, as far as takeaway, is the opening sessions speakers highlighted. Let me read this fully. Okay. The opening session speakers highlighted health disparities and showcased why we need to be advocates for health equity. There's a need to involve non-traditional public health professionals as part of the solution to public health concerns. I love that. That's talking my language right there. And that's actually something that the Surgeon General spoke about earlier this year, earlier in National Public Health Week 2018, about, the need and the power of non-traditional partnerships. And that's really what we need to do. Like, for example, public health agencies and the community church or community centers. So that's really important. And that is that's definitely a powerful way to attack this problem of, kind of reduce the health disparities. Another key takeaway here is that there's basically still work to do. And that's really putting it very simply and very powerfully. Let's see, there is one more I'll read to you. And this came from Timnit. And she said, the importance of statistical softwares in public health and the emerging world of IT is two hard skills, and many public health students should engage. So she said that the importance of statistical softwares and the emerging world of IT are two fields that students should engage in. They're hard skills to gain. So as a student, if you have the opportunity we all have the ability to learn, because we all have to take some level of, information technology, and we learn on some statistical software as a student. So really capitalizing on that and really sharpening that skill as a student is really important. And that's a very good point, Tim, that you bring on that. And I agree with you. It's a really important skill. And any student that catches that, that's really like a little golden nugget there, if you can take advantage of the ability to really sharpen those skills while you're a student and then expand from there. So that was some of our collective feedback. I had a message here from Raphael that he said that I wish I had the chance to meet folks from our Facebook group. And I agree with you. I really do. I met a lot of people from our community just randomly here and there throughout the course of the conference. And I found out afterwards that certain people were there that I didn't know they were going to be there, and I didn't get a chance to meet. And Raphael, I wish that we had a chance to meet as well. And I think that's something that I'll be thinking about it for next year. And I'm not sure how we can do that, but it would really be nice. We have a great community through our Facebook group. It's really interactive. We have a LinkedIn group as well, a podcast group. And I think it would be really nice to have a way to, I don't know if we need to find little identifiers where we can identify with other members in the group as we're walking around, maybe a pin or a shirt or something, or we arrange a time to get together. But if we try to arrange something, the trouble is there's already so much packed into that event that trying to add another time for everyone to get together would just be, I don't know, that'd be really, really difficult to do. But we've got a year. So, Raphael, if you've got some ideas, reach out to me. I'm going to be thinking about it as well. A way to, really meet in person as a community would be really, really nice. So thank you to all of the people who participated in my little survey and provided responses. I really enjoyed reading what others had to say and your takeaways as well. And, and just kind of reliving that little experience and just listening to what others had to say, that was just really appreciated. I thank you for doing that, everybody who participated. Now I just will add to that. I just narrowed it down to 5 things that I wanted to mention in terms of feedback. And I really could go beyond that, but I'm going to stick to 5. So my number one thing that I really liked about the conference, I don't know if these are going to be, I'm just going to call them takeaways. So seeing old friends. And I met with 3 amazing ladies that I graduated with. It was the first time that we had been together in the same physical location since our commencement ceremony. And I mean, although we've kept in touch over the years, and across the miles, they have each been a guest on my podcast. And it was truly a pleasure to see them again and share some laughs together. And it was great. So Dr. Braxton is... she was interviewed in episode number 4, Dr. Kathy Bianco in episode number 3, and Dr. Cynthia Hickman in episode 31. If you guys would like to check those episodes out, I was able to spend some time with these 3 amazing ladies, and it was a delight. It was exciting. We were like kids. It was just a lot of fun to just have those precious moments together at the conference. So. Hello again to all of you amazing ladies, and you guys check out those episodes when you have the opportunity. And another thing that I really like, my number 2 point here, is I was able to meet with so many members of our community face to face. Now, although I did not get to see everyone, and I hate to miss anybody, but my apologies for not being able to mention everyone by name. But to every one of you who came out and said hello to me, it really meant a lot. So a special hello to Jane, who reached out to me a few months before, several months before, but she especially let me know that she would be attending the conference. And we bumped into each other a few times during the conference. We even attended a Twitter party together, was able to sit together, and we ate and laughed, and it was just so much fun. I really enjoy getting to know her. My husband was with me at that event, so we've, it was just really, really intimate to be able to sit there and laugh and talk and enjoy the atmosphere. We pulled in another person that I don't even remember her name now, but we all sat together and really had a good time. But I really enjoyed meeting Jane and having those moments together. A special hello to Raul and Padma. Also, I met both of them last year at the conference, and I was so excited to catch up a bit with them and learn that they have both graduated now. They were both at the social function for the epidemiology section, and they came up to me and they both graduated, pursuing their careers in public health, and I felt like a proud mama getting their updates. So that was really, really exciting, and I enjoyed those few moments to see them and get hugs. So number 3 for me is meeting with a couple of members of my Developing Your Public Health Career Strategy program. So those of you familiar with that program. It is my coaching program that I developed early in 2018. And I've had several members go through that program throughout the course of the year. And I had a couple of members who actually attended the APHA conference as well. And we had been in touch with each other, and I knew that they would be there. But sitting down to discuss their progress in more detail was really, really nice. Working together in the online platform is great. And being able to then meet and visit face to face, just, I don't know, it's like an extra bonus. So a special hello to Rania and Ebony. I really enjoyed seeing you both, and I wish we could have had a bit more time together, but maybe next time we'll plan a special meetup for members of the strategy program. I think that would be really nice. We'll have to just make that happen. So number 4 for me is meeting new people. That was a huge benefit. Networking with other like-minded professionals is something I really enjoyed at this, about this event. So, there's just many professionals are really approachable at the conference where they may not, just be more difficult to reach out to them in another setting. So for example, our former APHA president, Dr. Jones, is an amazing woman. Being able to talk with her for a few minutes was like being recharged. She is such an intelligent and gracious leader with a caring heart. So that was truly a special blessing for me to be able to have some time to talk with her and meet her. It was also my pleasure to speak with the APHA's executive director, Dr. Georges Benjamin. I told him briefly about the podcast, and his response was, "That's really great. Thank you for what you're doing to help encourage others." That made me smile. I was a little starstruck. I got pictures with everybody, so that was really great for me. Again, meeting and speaking with these public health leaders was awesome, and the fact that they were available and approachable really stood out to me. All right, so number 5 is I was very pleasantly surprised to find out how popular the podcast is and realize how much it has grown since the beginning. That was a very pleasant surprise, but still was a surprise. It's one thing for me to follow the statistical growth. I follow the numbers every month, but it's so different to actually have people come up to me and say wonderful things about how much they've been enjoying the podcast, and was very moved by, I was just very moved by that part of the whole experience. So thank you all. That was awesome. There's so much more I took away from the meeting, but I need to wrap things up for now. So I'll spend some time processing my notes, as all of you should do. Those of you who attended the conference, I know you took a lot of notes. There's a lot of information. So I'll spend some time processing my notes, applying what I've learned, and, just feeding off of that information for months to come. All right, APHA 2019 will be in Philadelphia. So if you visit the APHA's website, you can get the exact dates and mark your calendars. But I hope you guys enjoyed this episode. And again, I want to say a special thank you to everyone that I met at the conference, but just was not able to mention you by name on this episode. You are all amazing, and I sincerely appreciate you for being a part of this podcast community. All right, so be sure to click that subscribe button so that you can get the latest episodes delivered directly to your mobile device as soon as they are released. You won't miss anything, and you'll be among the first to hear the latest episodes. All right, everyone, until next time, have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.